Okay, so everybody, we are talking about the integumentary system, and you know that the main part is the skin, and other structures include hair, nails, and glands of the skin. We have already talked about the skin and the glands of the skin. So today, first we'll talk about the hair. Hair is a dead structure of your body. Hair cells are dead keratinized cells, and that's why you can easily, cut the hair without pain, no sensation, right? Because hair is actually formed by dead keratinized cells. That means the cells are filled with keratin, that's protein, right? And lot of melanin is present in the hair. That's why the color is, dark or brown or other colors, because of melanin that gets mixed with the keratin. So keratin is the protein and melanin is the pigment. And the one thing, just know that the keratin of your hair is different than the keratin of your skin. The keratin of hair is more durable, long lasting than the keratin of your skin. Okay, so that's why I mentioned in last class, the hair lasts long time, will not be destroyed easily, right? You know that. So the keratin of your hair is different than the keratin of your skin. Okay. After certain age, the amount of synthesis of melanin decreases. That's why the hair starts to turn gray, right, or white, because the amount of melanin synthesis declines after certain age. If you see the structure of a hair, you have seen that when you saw the structure of the skin, it is like this. This is the skin. Okay, so this part is the shaft. This is follicle. Okay, and this is root. Hair root, hair follicle, hair shaft. And the part you see from outside, that is the shaft part. And this shaft part actually goes into the follicle and root. Okay, so if you see the structure of the shaft, if I just cut here and put under the microscope this part, you will see 3 layers in the shaft. Okay, 3 layers. Outermost layer is called cuticle. Okay, then cortex is the middle one, and innermost is the medulla. Okay, so cuticle, cortex, medulla is the innermost part of the shaft. We are talking about only the shaft. Okay. Now, if you see the structure of the follicle part here, if I make a cross section, you see you have the shaft inside, right? This part is the shaft going inside, but you have additional layers around the shaft. Okay. So what are the additional layers? You see, this is the shaft, this is the follicle. This part is the follicle, this is the shaft, right? So if I see the structure of shaft part only, this is the structure. Is it clear? Outermost cuticle, then cortex, then medulla. Now if I cut here, you see shaft is inside, right? But around the shaft you have additional layers. Make sense? So what are the additional layers around the shaft in the follicle part? Here, this is the cross section of follicle, this part. So you see shaft inside and additional layers. So first let's see the shaft. We know that shaft has three structures: medulla, cortex, cuticle, from inside to outside, right? And then additional layers are these. So around the cuticle you have internal epithelial root sheath. Okay? Internal epithelial root sheath. Then external epithelial root sheath. Then glassy membrane, and outermost is connective tissue root sheath. So those are additional layers around the shaft in the follicle part. So internal epithelial root sheath, external epithelial root sheath, glassy membrane, and outermost connective tissue root sheath. So that is the follicle. Okay. In the root part of the hair, you see this is the root all the way here. You have a couple of structures. Just remember the name. One is papilla. Innermost structure is the papilla. You have stem cells there, because you know that although this shaft part of the hair is dead, that's why you can cut easily without pain and sensation. No pain, no sensation. This is dead keratinized cell. Okay, but root part has stem cells. Those are alive. Okay, and these stem cells multiply to form and grow the hair. Okay, so from the root, new cells are produced, and that helps to grow the hair. You know that hair grows, okay, from the root. Okay, and around the papilla you have some melanocytes. You know that melanin, that pigment, is present in the hair. That gives the color of the hair, right? So melanocytes must be there. That makes sense. And these melanocytes produce melanin. So if the melanocytes in your hair from the hair root are producing dark pigment melanin, your hair will be dark. Make sense? If brown, your hair will be brown. That's how we see different people have different color. What kind of melanin these cells are producing? Okay, that is the color that person's hair. Okay, so those are a couple of important structures at the root. Now, there are different types of hair present in the body. Vellus. Vellus is the pale, fine body hair of children and adult female. So it is not thick or coarse. Pale and fine, soft hair. And terminal hair is the coarse, thick, dark hair present in the eyebrow, scalp, axillary, and pubic areas. Okay? And in male, additional areas are face and neck. So those are two types of hair. Then baldness. You know, baldness is related to hair, and baldness is the absence or lack of hair in the scalp, right? Not in the other part, in the scalp. So there are two types of baldness. One is called alopecia, which one happens to everybody, both male and female. The amount of hair decreases, right? After age 40, you start to lose hair, and that is alopecia, thinning of hair after age 40. That happens to both male and female. Okay. True or frank baldness is complete loss of hair. So you'll see part of your scalp has no hair, or the whole, right, scalp, no hair. So that is true or frank baldness. It is actually the main cause is hereditary, genetical, absence of particular gene. So this is genetically determined sex-influenced condition, true or frank baldness. And male true baldness or frank baldness is caused by follicular response to a chemical that is called dihydrotestosterone or dihydrotestosterone. You know, testosterone is the male sex hormone, and this is actually a precursor of male sex hormone, dihydro or dihydrotestosterone, DHT. And if someone's body produces this chemical more, that inhibits the follicle. Inhibit. Okay? So the follicle will not produce new cells, or hair root will not produce new cells. So that's why the hair loss occurs. Regulation of temperature, we have already talked about this. You know, in cold weather, what happens if you go outside in cold weather? You must remember in the dermis you have the sweat gland. We have talked about that in last class. This is the sweat gland, right? This is the duct, sweat duct, and this is the pore. Okay, the sweat comes out this way from the gland. In cold weather, what happens? Constriction of the duct and the pore occurs. That means the pore gets very narrow as well as the duct. Strong constriction, so the sweat will not get out easily. Okay, so no sweating means no heat will get out from the body. Makes sense? So it will be preserved, and we need that in cold weather, right? Heat should not get out. Then your body will be even more cold, right? So we don't want that. That happens in cold weather. If the body temperature increases, what happens? If the body temperature increases, we know that two ways your integumentary system decreases the body temperature: by sweating, number one. Number two, by vasodilation in the skin. Okay? So sweating releases the water out from the body and heat gets out from the body. Vasodilation, I mentioned in last class, in your skin, increases the blood flow in the body surface, so heat can easily get out. Make sense? We have talked about that in last class. Okay, so that's how the skin lowers the body temperature. Now, we didn't talk one thing. Who sends the sweat gland the signal to release the sweat? Who sends the signal to the blood vessels to dilate? That's the hypothalamus. Hypothalamus in your brain. Okay, so when body temperature increases, hypothalamus will send signal to the sweat glands to release sweat. Okay, and to the blood vessels to dilate. Someone has to tell them, do the task. Okay, so that is a very important brain structure called hypothalamus. Okay, we have already talked about dermatitis. You must remember. Dermis has how many layers? Anybody? Epidermis has how many? No. Yes, epidermis has 5 in thick skin, right? In thin skin, 4. Remember that, everybody? In thin skin, epidermis has how many? 4. Forgot it. It's just 2 days ago. Okay, so epidermis has 4 in thin, thick skin has 5, right? And dermis has how many? Inner reticular, outer papillary. So dermis has how many? 2. Okay? And I told you, reticular is dense irregular. That means tough, thick, right? Dense. And papillary is loose areolar. Remember from last class? So this is soft, right? So dermatitis is the inflammation of the outer layer of the dermis, which is the papillary layer, and soft layer will easily get, destroyed or injured. Hard one will not. So dermatitis is the inflammation of the papillary layer, which is loose area type of connective tissue. Okay, and what can cause inflammation of your dermis? Mechanical injury, something scratches you or bites you, right? That can cause damage. UV radiation, right? Radiation can cause injury to the tissue. Infection, microorganisms, bacteria or virus or fungi. Chemicals, acid or poison ivy that cause inflammation of the dermis. That is dermatitis, okay? Skin cancer, commonly heard, carcinoma of the skin. Good thing is that most of the skin cancers are benign, not malignant. Make sense? So, not that harmful. Do not metastatize. That means will not spread far. So, will stay localized, which is good. So, most of the skin tumors or cancers are benign type cancer or tumor, which is less harmful. The risk factors what can cause skin cancer. One is overexposure to UV radiation. You remember in last class I mentioned that melanin, that pigment, right, forms a shield. So UV radiation cannot easily pass through melanin layer, right, or shield. But if someone has less melanin protection, then the chance of skin cancer is more. Okay, UV can penetrate into deeper tissue. Anyway, so overexposure to UV radiation can cause skin cancer. Another is frequent irritation of the skin. If you repeatedly irritate any tissue of your body in that area, the tissue can start to multiply, the cells can start to multiply uncontrolled, abnormal, and that is cancer or tumor. Uncontrolled proliferation of the cells, right? We cannot control. Normal proliferation is what? Mitosis, right? We know that. One cell produces two cell produces four, right? That is mitosis, a normal way of the growth of the tissue. But if they start to proliferate or multiply uncontrolled way, that leads to cancer, right, or tumor. So, you know that everything is controlled by what? Inside the cell you have the nucleus, inside the nucleus you have DNA, right? DNA controls everything, right? Cell division is also controlled by DNA. So, excessive UV radiation can penetrate the membrane. So cell membrane, nuclear membrane, UV radiation can penetrate and cause damage to the DNA. Make sense? And that can change the behavior of DNA, right? If you bother them, right, too much, repeatedly, then that can cause some change in DNA, right? So when DNA will start to behave abnormal, cell can multiply abnormal because DNA controls that. Make sense? So if you bother the DNA too much, what can bother? Excessive UV radiation, repetitive irritation. It could be chemical or other means. Okay? For example, those people, want to fix the road, they use tar, that tar chemical, tar. So if they don't use gloves, if they don't protect their skin, if they frequently touch that chemical, that can irritate the cells. That can damage the DNA or change the behavior of DNA. So that can lead to cancer. So Now, sometimes you will see that some lotions that say that it protects UV, protects your skin, your body against UV, right? You will see the point, the lotion. Sometimes they use fake information that it will protect your skin 100% or 70% or 50%. Okay. Many cases that is not exactly what it does. Okay. So some are not good, and of course they can fix the damaged DNA. That is not possible. That is impossible. You can't fix the DNA. Now genetic engineering, they are trying to do that, right? We know that. Try to cut and paste and fix, but still we are not successful at that stage that that lotion can fix that damaged DNA. That is not that easy. Okay. Three major types of skin cancer or carcinoma are basal cell carcinoma, squamous cell carcinoma, melanoma. So those are three common types. Among these three, basal cell carcinoma is the most common and least malignant, which is a good news, right? Least malignant, most common type of skin cancer is least malignant, okay? Which is good. Squamous cell carcinoma is second most common, and then melanoma. Melanoma is most malignant, most dangerous type skin cancer. So in melanoma we see metastasis. In melanoma we see metastasis. That means the cancer cells spread, go to the deeper part of the body. Okay, spread into the deeper tissue. So that's why it is a problem. From outside you may see small area, but actually inside larger area is involved. Basal cell carcinoma, stratum basale, the 5 layers of the epidermis. Innermost layer is the stratum basale, a single layer of stem cells. Okay, and if the cells in this layer start to proliferate abnormally, that leads to basal cell carcinoma in the basal layer or stratum basale layer. This type of skin cancer is easily curable, treatable. If you just remove the tissue from that area surgically, that will cure the patient in 99% cases. So that is good. Surgically, removal of tissue will treat the cancer. Squamous cell carcinoma. The cells of stratum spinosum. You must remember another layer is spinosum. Stratum basale, stratum spinosum, granulosum, right? Lucidum, cornea. So if the cells of this layer, stratum spinosum, start to proliferate abnormally, that leads to squamous cell carcinoma. Okay? In certain areas, we see this type of cancer occurs more. In which areas? Scalp, ears, lower lip, and hands. Okay? So those are the areas. You see the picture. This is the scalp. So you see how squamous cell carcinoma looks like. Good prognosis if treated by radiation therapy or removed surgically. Okay, so radiation to kill the cells, right? Those affected cells, or you can remove surgically. Sometimes we do both. Remove the tissue, then make sure that other cells, abnormal cells are completely destroyed. We can use both to kill them. Melanoma. Melanocytes are the cells that produce melanin, that brown to dark pigment. So if the melanocytes start to proliferate abnormally, in high rate, that leads to melanoma. So we know that melanocytes produce melanin. So if in certain area melanocytes start to proliferate in high rate, lot of melanocytes will be there, right? Make sense? If melanocytes proliferate in this area, there will be lot of melanocytes, right? And there more melanocytes means more melanin will be produced in that area. So this area will look different color, dark or blue or brown, okay? It depends what kind of melanin is being, what color melanin is being secreted here. So when the melanocytes proliferate uncontrolled, the density of melanocyte increases, and that melanocytes release melanin in that area. So the color of that area will change. It could be blue or dark or brown. Okay? So by looking at the color, you can diagnose melanoma. The problem is, you see, from outside, you will think that only this area got cancer, but since metastasis is high, it goes into very deeper part of the tissue. That is the problem. So you have to do what? Wide range surgical incision. That means if you only remove the tissue from here, that will not treat the person, because in the deeper part you also have the cancerous cells. So you have to do widespread surgical removal or incision. Okay? And immunotherapy. You know, we use immunotherapy to treat the cancer patient. Have you heard that? Immunotherapy, right? So we produce antibody outside of the body, outside of the patient's body, right? And that antibody can selectively find the abnormal cells or cancer cells. When you inject those antibodies, they will go to find the cancer cells, right? And will put flag on those cancer cells. Make sense? Marker on those cancer cells. And then your body's antibody will find them and destroy them. Make sense? So now that is a very good way to identify the cancer cells and destroy them. Okay? So that is immunotherapy. Monoclonal antibodies. The most commonly used antibodies. Monoclonal antibodies. Okay? They will find the cancer cells of your body and will put flag or markers on them. Burns. Another commonly heard clinical condition, burns. Why we hear this term a lot in terms of skin? Because we know that the skin covers the body, right? And if anything comes from outside, your skin will first take that hit, right? That attack. So we hear the burn of the skin a lot. Now, the main problem of burn are, there are two problems. One is when burn occurs, dehydration, loss of water. Water comes out from the body. So that is a problem, dehydration. And another is, with that water, electrolytes also come out. Okay, so water and electrolytes come out. So electrolytic imbalance and water loss. Those are two main problems, okay, of burn. And that is the main reason why the patients die. When electrolytic imbalance occurs, your heart function becomes, heart starts to behave abnormal, irregular. Electrolytes, calcium, do you remember calcium? How important? Lack of calcium can cause paralysis, right? Respiratory paralysis. The person may die. I mentioned that at that time, right? Calcium, very important. So if those electrolytes come out from the body with the fluid, that causes electrolytic imbalance and all kinds of problems. Okay, so those are two main concerns of burn. Now, by looking at the layers affected by burn, we classify the burn into three types: first degree burn, second degree burn, and third degree burn. In first degree burn, only epidermis is damaged. So if you see only epidermis is damaged, dermis is intact, that is first degree burn. Dermis is not impacted, so dermis is fine, only epidermis. If you see epidermis and part of dermis, partially, dermis, that is called second degree burn. That is epidermis and upper part of the dermis, not the whole dermis. In third degree burn, the entire skin, that means both epidermis and dermis are destroyed completely. Okay, so depending on the layer got damaged, we classify the burns into first degree, second degree, and third degree. Okay? In first degree burn, you will see redness, localized redness, edema, and pain. In second degree burn, you will see blisters also appear. And in third degree burn, the patient doesn't feel any pain, no sensation. Why? Because when the entire skin is disturbed, you can easily just think, when entire skin is disturbed, we know that the blood vessels, nerves, everything is disturbed now, right? So if you don't have any nerve there remaining, then the person, you won't feel any pain, okay, initially. So immediately after, the patient will not feel sensation or pain because the nerves are also destroyed. In case of third degree burn, since the entire skin is destroyed, no stem cell is remaining there, so no skin tissue will be regenerated because whole thing has been destroyed. No stem cells are left there, so no new skin cells will be produced. Okay, so you need grafting. You need to take skin from another part of the body and put there. Okay, that is called grafting. Yeah. So those are three types of burns. You see in this picture, in this patient's hand, in some areas you see redness and swelling, that is first degree, and in some areas you see blisters, the second degree burn. It's whitish areas. This is third degree burn. The entire skin has been destroyed in this case, so no new skin tissue will be formed there, so you have to do grafting. You have to take skin from another part of the body, usually from the same body, because if you take tissue from another person's body, you know, right? Your body may reject it. We have talked about that before, right? So that's why you need grafting. Okay, so skin cancer or carcinoma and burns. Those are two commonly heard clinical conditions. Now, another thing is to know that it is not on the slide. How much body area is affected? We determine that by rule of 9. That is called rule of 9. What is that? This is the head, neck, okay, trunk, lower limbs, upper limbs. Okay? So this is the person. If the entire head, the skin of the head part of the body is considered as 9%. Okay? Then trunk, the front of the trunk is 9, 2 nines. Back of the trunk is also 9 and 9%. Okay? So front of the trunk, if we divide the front into 2 parts and also back into 2 parts, 9, 9 in the back, 9, 9. Okay? So 4 nines. Your upper limbs, each upper limb is 9%. Okay? So how many nines we got? 1, 2, 3, 4, 5, 6, 7. Then your leg, each leg, front is 9 and back is 9. That means 9 front, back is 9. So each leg is double than the upper limb. Front is 9, back is 9. So 2 nines basically. Each leg, a lower limb is 2 9. Trunk is 4 9. So 1, 2, 3, 4, 5, 6, 7, 8. Then 9, 10, 11. Okay, so 11 times 9. That is 99%. Okay, body surface. And your perineal area is 1% only. Okay, so perineal area is 1%. So 100%. Okay. So that's how we determine how much body area is affected. If we see 1/4 of the trunk, we'll say 4%. Make sense? If we see entire front, 9, 9, 18%. Make sense? Entire back, 18%. Entire one leg, 18%. 2, 9, right? Entire upper limb, 1, 9, 9%. So that's how, that is called the rule of 9. Okay? To determine how much body surface or skin got burned. Okay. Nail. I may ask you that what is the rule of 9? Explain the rule of 9. Okay. So you will just draw this picture and also explain that I explained to you. Nail. Nail is important for some people, right? You'll see some people takes care of nail for a long time. Sit in the parlor. I don't care nail much, so I won't go into detail. Just the parts of the nail. The nail has different parts: body, free edge, root, nail force, proximal and lateral, epinecium, which is also called cuticle, hyponecium, nail bed, and lunula. So we'll see where the structures are. So the body of the nail rests on the nail bed. So under the body you have the nail bed. So if you cut the finger this way, this is the picture. So this is nail bed, and on nail bed you have the body of the nail. This one. Okay. Then all the way to the back of the body you have a white crescent shaped area that is called lunula. Okay. And then the most distal part of the nail, where there is no support of nail bed, that free part is the free edge. Underneath there is no nail bed. That's the extended part. And in both sides you have lateral nail folds. Okay? Lateral nail folds. And then if you see here, the part of the nail behind the lunula, that white crescent, we can see this part, but we don't see this part that goes into the finger. That part is the proximal nail fold, and most deeper part of the nail is the nail root, like hair root. Okay, all right. We have the stem cells. Okay, so in this picture you can also see free edge, the body, lunula, that white crescent, and then the nail root. Okay. Now, small amount of tissue is present under the free edge that connects the nail to the fingertip. That small amount of tissue structure is called hypomysium. And another small tissue structure is here that connects the lunula to the skin, that is called epimysium. Okay, so those are the structures of the nail. Again, you see the body rests on the bed, free edge, and lunula. Those parts you can see from outside. Now if you go inside the finger, that you don't see from outside, you see proximal nail fold and nail root. Now, nail is also a dead structure, like your hair. That's why you cut the nail without pain, without any sensation. And then how the nail grows, if it is dead, we know that in the root we have stem cells, like here. So that's why the nail grows. Now remember one thing, your skin has keratin, your hair has keratin, your nail has keratin. All have dead keratinized cells, right? That means the cells are filled with keratin, that protein. Keratin is a highly specialized protein. Now, the keratin of your skin, I have already mentioned, is different than the keratin of your hair, right? Which one is more durable? Hair, right? Long-lasting keratin. Skin, keratin is less long-lasting. Make sense? That's why skin is destroyed after death. Skin will be destroyed easily, but hair won't. Right? Nail has also different type of keratin. Now another thing, why the color of your hair, skin and nail is different. If all are filled with keratin, should have same color, right? We already know that melanin, right? Your skin has melanin, right? But more melanin is present in the hair. Make sense? That's why the color of hair is dark. Nail. In nail, you don't have melanin. You have only keratin. Make sense? That's why the color of nail is not colorful. It's not dark color. So the color is given by melanin. That's why the color of skin, hair, and nail is different. But all these three structures have protein, that is nail, that is keratin. Okay, so that's all about the integumentary system.